Back, fresh, new episode, Vince.
Yes.
Episode number 24
Yep.
of the Clinical Dose. We've got 5 questions from Instagram, YouTube. Good spread here for this episode, Vince. Let's dive straight in.
Let's do it. First question, how to choose the right type of protein bar and why don't many people use protein bars over powder? It's easy and on the go. From Sh3riff Ps5 from YouTube.
Oh man, I personally, I haven't eaten a protein bar in years.
Yeah.
It's been years
it's been a while.
since I've last had a protein bar. And I think for me, and I'm gonna speak from personal opinion, and then we can kind of go into the general sort of information.
Yeah.
For me personally, I have a big problem digesting protein bars.
Yeah.
I don't know if it's got to do with the sorts of proteins that are being used, some of the gums, some of the fillers, some of the I don't fucking know.
Yeah.
But like, that's why I stopped consuming protein bars, was because every time I had one, it would just mess up my guts.
Yeah.
So that was the big driver for me. What about you, Vince?
Quite similar. I don't just digest them too bad, but for me, I prefer to get that protein from a shake because I'm getting the same amount of protein, less carbs, less fat.
Yeah.
And then I can consume it through other whole foods instead of a bar personally.
Yeah.
Plus, I found after too many, I get the same thing, don't digest too well, whether it's alcohol, sugars in there as well.
Yeah.
This is another thing they tend to not digest that well either in terms of the fibers.
And I think really when you're considering protein bars, people are eating protein bars as a source of protein, right? If you're not going to do that, you're going to eat a Mars bar or a Snickers bar or whatever the fuck. You're consuming a protein bar to get protein. So then the question that you look at is, okay, is this a good source of protein? Some protein bars, they're using whey proteins. Other protein bars, not so much. They're using all sorts of shitty proteins. The next question is, what's the value for money?
Yeah.
And that, for most protein bars, is where it falls down, because you go, well, a bar's going to cost me in the Australian market $4 to $6 and get me 20 grams of protein. A scoop of protein that's going to get me the same 20 grams is going to cost me $1.
Yeah.
So it's 4 to 6 times more expensive. But then you kind of weigh it up and you go, like Sh3riff has said here, is that it's easy on the go, it's convenient. So, how much is convenience worth to you? Some people prefer protein bars because they fill them up a little more than drinking a shake, for example, or having a sludge or whatever it is. So then it comes down to really a question of personal preference.
Yeah.
For my personal preference, I don't fuck with protein bars.
Yeah. I have, if I'm on the go and don't have anything with me, I'd prefer to go for a protein bar over like a Snickers bar or something like that. But yeah, it's not very often that I do consume them.
Yeah, and I think also from a business perspective, if you go back 5 years, we used to sell a bunch of protein bars. We had Noji bars, Quest bars were really big there for a while. ProSups did a bar that was really popular.
Yeah.
It's kind of ebbed and flowed, but at the moment, we just don't sell protein bars at all. So I think really the market for them and the demand for them, a lot of people are probably coming to the realization, like we just said, that most of them are not really great sources of protein, and the ones that are super expensive sources of protein. And if you can get your shit together and get organized, being convenient and on the go is not a big deal, because your meals are convenient and on the go.
And then the other thing as well, training, I tend to split up my carbs and fats. And most protein bars have some form of combination of both. They will have a combination of both. Majority anyway are going to have a fair bit of fat with a decent amount of carbs as well.
Absolutely. Next question.
Tips to improve strength and muscle growth when you seem to have reached a plateau, from Southpaw 1985 from Instagram Q&A.
Interesting. I'm gonna tackle the muscle growth.
Yep.
You're gonna tackle the strength.
Strength?
From a muscle growth perspective, when you hit a plateau, it effectively means one of two things. Firstly, you're no longer in caloric surplus, so your metabolic, your metabolism has adjusted upward to meet what was causing you to be in caloric surplus in the first place. You're no longer in caloric surplus, so your body doesn't actually have the building blocks it needs to continue to build muscle. So the first solution to that is to increase your caloric intake, eat more effectively. Obviously at this point you're consuming enough protein, so we don't even need to go down that path. The second reason is that you're not stimulating enough muscle growth, or you're not stimulating incremental and additional muscle growth. You're just going through the motions with your workout, you're lifting the same weight for the same reps, and there's no progressive overload. The recipe for muscle growth is progressive overload plus caloric surplus equals gains. When you reach a plateau, you're either not progressively overloading or you're no longer in caloric surplus. So it's a really easy fix. Strength.
Strength. I mean, I don't train for strength, so it's kind of. I train for muscle
I
growth.
just handball that one over to you, Vince.
Throw me in the deep end.
I mean, look, the principles are the same.
Yeah.
Right.
I was gonna say, yeah.
Yeah, it's just then, from a strength perspective, there's some different nuances, right?
There is, yeah.
Where if you're trying to get your bench to a certain level, and you just, you're progressively overloading, you're in caloric surplus, and you just can't shift that particular lift, it might be time to go and do different accessory type movements.
Yeah.
Because perhaps you've got stabilizers that are not prepared to move that certain amount of weight. Maybe you're trying to reach a certain squat and you just can't get past 200 kilos on your squat, and you're trying to get to 202.5 or 205 or whatever it is, well, maybe you need to stop squatting and go and do accessory movements, leg extensions, hamstring curls, glute bridges, hip thrusts, those sorts of things to work on the muscles that are not directly involved in that particular movement pattern, but are indirectly involved.
Even with strength as well, when training for, a lot of people will judge their strength by their 1 rep max, and that's what they'll try and hit that every time. Breaking it back and trying to improve a 5 rep max and make improvements there will then correlate to being able to have a stronger 1 rep max. So even break it down, if you are just continuously going for 1 rep maxes, which I wouldn't recommend, breaking it down and changing up your training routine a bit and maybe going for a 5x5 kind of routine to build that strength back up again.
100%. And I think with strength as well, as opposed to muscle gain, I mean, in both, rest and recovery is quite important. It's probably more important when we're talking about adding incremental strength on those 1 rep maxes than it is for muscle gain. But rest and recovery is an important piece as well.
And then food, even your breathing, how you're feeling for that strength, if you're testing, can come down to a big kind of changes as well. So,
absolutely. Next question.
In regards to clinical doses of some supplement ingredients, how much body weight or lean body mass affects those dosages? For example, if 5 gram serving of creatine is a clinical dose, is that the same for someone who weighs 60 kilos compared to someone who's 120 kilos? Are they worked out on an average basis, and you might need to scale them up or down depending on your size? From Keith Redfern from YouTube.
This is such a great question.
It is.
And I can tell that Keith is a keen supplement consumer. Because this is kind of deep down the rabbit hole of, when they do these studies to scientifically validate clinical doses, what are they basing them on? What body mass are the athletes? Are they male? Are they female? What's their, how often do they train? There's so many different variables that go into this. The easy way to answer this, Keith, is yes, you are correct. You do need to scale up and scale down depending on your body weight. And most of these clinical studies are done on average trained males and females. So if you say an average guy, I don't know, let's just pluck some numbers, Vince, as like a rule of thumb, right?
I would say around the 80 kilo mark.
80 kilos,
for average trained
15% body fat, probably training 3 or 4 times a week. For females, 60 kilos, probably 20 to 25% body fat, also training 3 or 4 times a week. That's kind of the baseline average. So if you're a mass monster, and I remember vividly like watching Ronnie Coleman DVDs back in the day, right, when he was sponsored by BSN, and he'd take like 4 scoops of NL Explode, right, before he trained. He'd take like 6 scoops of Synthesis, and I'm just like, what the hell is he doing? But he was, 130 kilos on stage. Just a big, like literally twice well, more than twice, really, the sort of studies that these clinical doses are validated on. So yeah, Keith, absolutely awesome question. And, it depends on where you sit personally. If you're kind of that, that average kind of build, average training intensity, average body fat sort of thing, stick to your clinical doses in quotation marks. If you're bigger, you can bump them up a little bit. If you're a little bit smaller, bump them down a little bit.
And take like creatine, the body will lose 3 grams, the average body will lose 3 grams of creatine per day. So that's why most things will say supplement with 5, make sure you're covering that, plus then storing some for to kind of reach the saturation point. If someone has more than that average population, they're going to lose more.
100%. And some of it's trial and error as well. Like there's certain supplements. I know laxagenin was a big one that we did a bunch of just anecdotal studies on because no one really knew what the clinical dose of laxagenin is. I used myself as a guinea pig. I like super dosed it and then did small doses, and then I kind of found like a milligram per kilo of body weight per day was like the sweet spot. Any more, you don't really get much better effects. Any less, you start to lose effects. So a lot of the time, it's a little bit of trial and error as well. Until you get the effect that you want from a particular scientifically validated supplement, mess around with the dosing a bit.
100%.
Next question.
How would your body respond in looks if you change your macros while keeping your calories the same? From Sh3riff on Instagram Q&A.
Oh, I actually got this question.
Oh, did you?
Yeah.
There you go.
In one of my Q&As. And I answered it, but so I'm going to handball this one to you, Vince. What do you reckon?
I mean, it depends. So, I mean, dropping your protein, you may lose some muscle tissue. Adding your carbs, you're probably going to still hold more water. You might look a bit fluffier. Fats, same thing. Dropping your fats too low, your hormone profile might change, and then which can change your look. So definitely changing your macros can change kind of how your body looks. In particular, most people will change their carbohydrates. They might drop their protein, add in some carbs, vice versa. When they drop their carbs, they might look a little bit leaner, adding in more protein. Dropping their protein, adding in more carbs, they're probably going to look a bit fluffier, holding more water.
Perfect answer.
Perfect answer.
And I think the degree of difference in the way your physique appears is going to really depend on your body fat as well.
Yeah.
Like if you're like stage lean
Yeah.
and you go and have a high carb day, like one day of having the same calories, but you take all of your calories from fats and use carbs, you're going to look like a completely different person than when you go back to a low carb day, same calories, carbs have come down, fats have gone up. So, you know, your body fat level has a lot to do with that. But perfect answer, Vince. I mean, you know, the answer to the question is yes, 100%. The macros that you consume to achieve a certain caloric intake have a huge effect on metabolic processes, hormones, the way you appear, the way you feel. You know, long gone are the days of just tracking calories and going, well, you know, however I get there, I get there. You have to pay attention to your macros.
100%.
Last question.
Hey Joe, would you ever take the COVID vax? Since there's a lot of talk around the world from world leaders about getting everyone jabbed before we can completely go back to normal, especially here in New Zealand, because I'm judging from the ingredients and side effects, it definitely ain't going to be help with gains. From Richie Rich from YouTube.
100% unequivocally no. I will not be getting the COVID vaccine. I've given this a lot of thought. And I've had many discussions with many different groups of people about this over the last couple of months. People my age, people older than me, people younger than me, people with different political views than me, so on and so forth. The reason why, the justification for me, why I would not get the COVID vaccine. The first reason is there are absolutely no longitudinal studies on this vaccine. There can't possibly be because it was rushed to market within and you got to remember like how long vaccines take to develop, years. This was rushed to market in 9 months. They have no idea what the effects of this vaccine are going to be in 2 years, 5 years, 10 years, 20 years, 50. And you know, guys like us, you know, you're in your 20s, I'm in my 30s. We're living 60, 70, 80 years. There's no one can tell me what effect this vaccine, it may have nothing, right? It may be no longitudinal side effects, whatever, beautiful. No one can tell me that with any sort of certainty. I'm not going to risk it. The other reason is because we now have the data where if you are not vulnerable, right? So you're not, what do they call it? Like a immune, vulnerable to disease. I can't remember. There's a fancy fucking word for it. I can't remember. Anyway, you know, if you're not in the vulnerable case, so like you're, you know, over 70 years old, you've got pre-existing respiratory conditions or pre-existing health conditions, or you're, you know, if you get COVID, you're going to have serious health complications. We have the data now. We know that people like you and I, who are young, we're fit, we're healthy, immune compromised. That's what it is. We're not immune system compromised. We take care of ourselves. If we contract COVID, we're going to be sick for a couple of days. We might not be able to taste anything or smell anything, and then we're going to be all good. Right? We have the data. We know that's what happens now. So the benefit for me taking the vaccine is literally nothing. Right? The risk associated with taking the vaccine is completely unknown. That risk to reward ratio for me makes absolutely no sense. So there's no way I'm touching the vaccine.
I mean, I'm the same till they come out with some good studies. Because I think I saw, I don't know whether it was true or fake news, but the Pfizer vaccine, was there deaths associated with that already? And they're mass rolling it out in countries. It's like, so they have no clue really. And then they're coming out with these articles saying that the vaccine has changed strain to this vaccine, then target that other strain, or is it
Yeah.
useless?
Yeah.
So
and you know,
I don't know.
And this is what's happening, right? There's so much information that we're not going to know until after the fact. So
Yeah.
now you're right, they're rolling the vaccine out in the UK. They haven't in Australia. The TGA still hasn't even approved it here, right? So
Yeah.
that says something in its own right.
Yeah.
They're rolling it out in the US. You know, they're starting to roll it out worldwide. And as they're rolling it out, they're going, oh, well, this doesn't actually stop anyone getting COVID.
Yeah.
So it's actually not a fucking vaccine in the first place. It just makes the symptoms less serious.
Yeah.
But like, what are we talking about symptoms here less serious? We know that less than 1% of the population ends up, you know, more than having a normal type of cold.
Yeah.
Like, you know, there's so much about this COVID that just doesn't stack up to me.
Yeah,
You know, I don't want to
agree.
get into a political argument. There's a time and a place for that.
Yeah.
And I know all of our viewers probably have their own stance on it. Most of the people I've spoken to that are in our generation and our age group
Yeah.
are just like, what the fuck is this all about anyway?
Yeah.
And just questioning everything. And I tend to have that same view. But there's so much data and there's so much information that does not make sense to me.
I agree.
So back to the question anyway, I will not be taking the COVID vaccine.
Neither would I.
And you know, if they implement some bullshit rule where they're like, you can't travel internationally unless you've got the vaccine and some digital health passport, whatever the fuck that
Yeah.
looks like, there's going to be a constitutional law challenge on the basis of that for sure. So
There you go.
sit tight.
Yeah.
Vince,
That's it.
that's a wrap. Episode 24. Guys, if you have a question that you'd like us to answer in the next episode of The Clinical Dose, the best place to put it, we had three YouTube questions.
Yeah,
The best
two
place
more.
to put it is right here on this video, down below in the comments section on YouTube. That's where Vince picks them from first.
Yep.
IG Q&A on the MassiveJoes, on my personal, at Joseph Mencel on Instagram. We tend to pick them from there.
Yep.
The MassiveJoes exclusive Facebook group, for those of you who are in there, who have been invited to that group, we pop a question box up in there.
Yep.
Come from all the places, but the best place is right here on the YouTube channel in the comment section. Vince, that's a wrap.
That's it.
Guys, hit the subscribe button. Subscribe to the MassiveJoes YouTube channel. Don't forget to turn your post notifications on so you don't miss a beat when it comes to all these new episodes of Clinical Dose for 2021. Until next time, where we're coming to and from, Vince.
MassiveJoes.com.
Stay massive. Thank you for tuning into this video. We hope you enjoyed watching. Don't forget to check out our latest upload and our recommended video, and be sure to subscribe to the MassiveJoes YouTube channel to stay up to date with all of our latest uploads.